relieve the patient of discomfort. We decided that we are going to pull this tooth because it's just too much trauma. The tooth has already been loose, and we've got to make sure that we're removing the tooth so that it doesn't cause her any more pain. Look at the x-ray here. The tooth is slanted. The tooth on top is putting a lot of pressure on it that makes that tooth loose, so that when we go ahead and take this tooth out, it's going to be fairly simple to take out just because it's already loose. And once we start seeing the tooth getting looser and looser, you'll see that that tooth will just pop out. As a patient, you're thinking like, is this going to hurt? But it's not uncomfortable. Once you get that tooth very numb, it's not very hard to remove that tooth. When we're looking at a case, especially in the morning when we start our dental office, we're looking at a situation where we're going to try to help this person with a problem. And in this case, in this situation, we've got a patient who has a tooth that is hurting them. Right here, what you have is a tooth by itself where the upper teeth are hitting this tooth and causing pain to this one particular tooth. Now, why is that the situation in this case? So if you go ahead and take a look at this tooth, it's already slanted. It's slanted in a way where it's taken a lot of the forces that is being exerted by the upper teeth. Now, you could also try to go ahead and give this person a mouth guard, plate that goes right on top of the teeth so that it will keep the upper teeth and the lower teeth from hitting each other and distributing the forces on all of the teeth, not just one tooth. So what we do as dentists is we're able to make a night guard, a mouth guard to put on top of the teeth so that they will be in between the teeth to level the forces that is put on teeth. Now, if you go ahead and take a look and see how these occlusal guard are made, they just cover just the surfaces of the teeth and then be able to make sure that the teeth are covered so that we could protect them. Now, in this video, what we're going to try to do is relieve the patient of discomfort. We decided that we are going to pull this tooth because it's just too much trauma. The tooth has already been loose, and we've got to make sure that we're removing the tooth so that it doesn't cause her any more pain. Now, once we get a shot, an injection in the tooth, what we're going to try to do is make sure that the tooth is comfortable enough so that when we go ahead and take the tooth out, the patient is not in any discomfort when we do this. So we'll go ahead in this situation, we'll go ahead and numb up the gums. There's a couple of ways to do this. One of the ways is inner ligamental injection into the gums. The other way would be just a mandibular block, which is a block of your whole jaw. And in this situation, we are putting the anesthetic right around the tooth. So most of the time, this is going to work just because we just want to take out that one particular tooth. We might do this a few times. We might do this, make sure that the person is comfortable. So we'll do this injection a few times and make sure that all the ligament that surrounds that tooth is numb. If you look at the x-ray here, the tooth is slanted. The tooth on top is putting a lot of pressure on it that makes that tooth loose, so that when we go ahead and take this tooth out, it's going to be fairly simple to take out just because it's already loose. So we'll go again, make sure that we put some more anesthetic, ask the patient if the tooth is comfortable for us to remove. So the technique here is we're going to make the gums very comfortable for the tooth to come out. So this is what we call interligamental injection around the tooth. Now, this type of anesthetic is not uncomfortable for the person, the patient that we're doing this to. They'll feel just a little pinch, but once you go ahead and get it numbed, not going to be a big problem to go ahead and numb this up. So the first thing that we'll do is we are going to sever the periodontal ligament. We'll go ahead and make sure that the person is numb when we do this. So the first thing that we'll ask is, do you feel that? But when we're taking out a tooth just like this, what we call a simple extraction, we're going to be able to go ahead and remove this tooth without too much trauma on the tooth itself and around the gums. So what we'll do is just put the elevator around the tooth, make sure that we could wiggle that tooth. And once we start seeing the tooth getting looser and looser, you'll see that that tooth will just pop out. As a patient, you're thinking like, is this gonna hurt? But it's not uncomfortable. Once you get that tooth very numb, it's not very hard to remove that tooth. Once you got the ligaments severed, once you got the tooth loose, you could surely go get a forceps to go and grab that tooth and be able to hold it, pull it out, and once you get that tooth out, it's very comfortable for the patient. So it's not very difficult to do. What we call in dentistry a simple extraction, not necessarily a surgical where you cut out the tooth, but make sure that the person is comfortable when we take that out. So as we're assessing this tooth, when we're looking at the x-ray, when we're looking at the procedures that we're going to do at a particular time of the day, we're going to assess how simple can this tooth be removed and be able to plan our day so that the patient is comfortable, make sure that the patient doesn't feel what we're doing when we extract the tooth, and make sure that the person is being seen, followed up, so that the situation that they have, which is occlusal trauma on this tooth, is not happening on other teeth. And that's the reason why we have an occlusal guard to protect the teeth. And in this situation, we're going to have to make her a new partial denture. And the other choice for that would be a dental implant to support a partial denture or to support a new crown to take place of the tooth that we just extracted. So until next time, make sure you watch our next video and subscribe to our channel.